Welcome to the One Piece Implant Mentor podcast. I am your host and mentor, Dr. Andrea Joy Smith. The One Piece Implant Mentor podcast introduces the audience to doctors who are successfully placing one piece dental implants. My guest today is Dr. Jim Tharp. Dr. Tharp is in private practice in Frankfort, Illinois, where he established and operates a mini dental implant center of America. But private practice is only a fraction of Dr. Tharp's dental occupation. He is a dental professor and educator who has taught multiple dental disciplines in 17 different states and 3 countries. Not to mention the time he has spent on his own professional development at the Pankey Institute and the Dawson Academy. And I have personally learned a lot from him in the area of TMJ anatomy and function, but his credentials in one-piece dental implantology are not to be overlooked. Those credentials bring him here with us today. Jim, welcome to the podcast.
Hi, Andrea. It's a pleasure to be here, and I am honored that you should ask me to speak on your podcast. This is really fun.
Thank you very much for joining us. I appreciate it. So, Jim, let's just start by telling us, how long have you been in dental practice?
I graduated Northwestern Dental Prison in 1975, escaped from there, and proceeded to start in with my dad. My dad had been a dentist since 1941. I worked with him for 27 years. His father was a dentist before him, and his dad was at Northwestern, as was my dad's brother and his brother-in-law. And my grandfather's dean at the dental school was G.V. Black, if that means anything.
That means a whole lot. Not only is it generational, but it also goes back to dental history. G.V. Black is the inventor of the amalgam restoration.
He did a lot.
Yeah.
He invented all the tools we use. He invented the
mention
dental
all of his
drill.
contributions.
Yeah.
That is very impressive. Tell me a bit about your career before you established the Mini Dental Implant Center of America.
My dad was my first mentor. He taught me all sorts of things. He taught me that if you have to do dentistry well, you have to see well. So I've used loops all along. I use 6-powered with a headlight now. He also taught me that if you are not a constant student, you will be left behind. I forgot to mention, as part of our dental history, my late wife was also a dentist, and her mother was a dentist, and 2 of my kids, Stephen and Maria, are both dentists.
I have met Maria. I didn't know that your son was a dentist as well. Very good.
Yeah. So anyhow, back to history of dentistry in our family. My dad taught me that you just have to be a constant student. To that effect, I started taking courses at the Pankey Institute in the late 70s, early 80s. I took all 6 of their continuums. I then took all of Dawson's continuums, and Mark Piper I learned jaw joints from. I learned how to really do dentures well after my late wife passed on. She was my denture specialist, so I then followed Joe Masad around the country and took all his courses, and he actually had me come teach with him for a while. I feel very honored to have worked with some great people. Also, I should mention Gordon Christensen is a good friend, and I've been a evaluator for him for 40 years or more. Every time I see him, he is just a wealth of knowledge. Good friend.
Yes, he is. As are you. And now I'm beginning to put the entire picture together to figure out why you have always been so knowledgeable with all the different subjects. Can you talk a little bit about your professorship opportunities?
When I was about a year in practice, one of my professors at Northwestern called me up and said, one of our professors died. Can you come take over his spot? And so I went in there just one day a week, but I did that for about 3 years. I was teaching in removable prosthetics, of all things, back then. My second gig as a professor was at the University of Illinois. After my late wife had died, I wanted to keep up friendship with the friends at the university, and so I volunteered and worked there as an assistant professor for about 3 or 4 years. The reason that both of those things ended was because of politics in the dental school. If you've ever taught in a dental school, you know there's politics, and I just hate that type of thing.
There's unfortunately politics everywhere. When did you establish the Mini Dental Implant Center there in Frankfort?
I started doing implants in the 80s. I took a whole bunch of courses back then on how to do implants and started restoring implants and doing implants. One of my first dental implant patients was my dad. These were the old screw together the base and the abutment and hope that it doesn't come loose or break. I was very successful with my dad. There's different types of success in dentistry. If your patient passes on with the implants in their mouth, then that's called room temperature success. And I have had a lot of room temperature success, including my dad's case. I started doing minis just after Dr. Todd Chatkin started. He started doing them in 99. I think my first were around 2001, 2002. I got that same VHS tape that Joe Gillespie had filmed for his dad, and I watched that, and I'd been doing implants for a while, and I thought that's really cool stuff. So I went ahead and did 3 or 4, maybe 5 denture stabilizations, and they worked, but I didn't pursue it actively. And then comes around 2012, I got a flyer about doing minis other than just doing denture stabilization. My first case was a roundhouse in January of 2013, and it's just been amazing ever since. I got to my first course March of 2013. If you can't learn something new, you shouldn't be doing it. It's that simple.
So what attracted you to the one-piece implant or the mini dental implant, given your history of placing conventional implants?
You have a few screws loosen up, and you decide that there's got to be a better way to do it. There's just no joy in drilling through a brand new crown that's a couple months old, having to tighten up a implant screw that loosened up on you. So I went ahead and decided that's one factor. The other factors come out more recently, and that is that peri-implantitis is much less when you don't have a microgap junction between the abutment and the fixture. So I've seen that over the years. Other things that I've learned, the LPRF, that was 2014, I think. Nat LaSorsa and I, and probably you were there at that meeting in Vegas, when Terry Journo told us all about how successful LPRF is. Matt beat me. He bought the machine that Terry Journo had brought to the meeting. I had to wait 2 months, so Matt's been doing it 2 months longer than I have. I'm excited about the mono implants simply because I've done 300-400 of them, and their success rate is phenomenal. They're bendable. I don't know why they're so successful. My guess is because the neck is smaller. It's kind of like doing a platform switch on a traditional.
I was just going to say platform switch. That is exactly the reason I believe that they are. Yes.
Yeah, without having to have a microgap that collects bacteria.
Exactly.
And that is cool. I can't say enough about it. In the last 10, 11 years, I've put in thousands and thousands of implants, and absolutely none have been the kind that are held together by a screw that can loosen up.
The fact that the one-piece implant doesn't have multiple parts is a definite attraction to the one-piece implant. So when you started offering these one-piece implants in your practice, of course, we see that more people are accepting, largely because of their reduced costs, the reduced surgery. What's been your patient's response to offering this procedure?
When you compare the prices, it's about a third more to do the traditional implants than it is to do a one-piece, one surgery implant. And that's another advantage. It's faster, it's quicker, less appointments. I'm convinced that it's just much better, and it costs less. So that's the deal.
I know you probably find this to be the case too, is there are a lot of patients who are considered medically compromised and who are not able to go through the 2-stage or 3-stage surgery if you include a bone graft, and the length of time that it would take to actually receive one particular tooth. And one of the things that attracted me to it is just the immediacy of it. If you reach that 30 Newton centimeters torque or a little bit above, you can load that implant the same day with either a temporary tooth or either the denture restoration. I'm pretty sure that you've had that experience as well.
Absolutely, and where you actually finish up with your final restoration too. I've done many of those, and that's such a plus for the patient. They come in with a space They go out with a tooth that's a final tooth, no extra visit. I love that. So many advantages to doing one piece, not separated by a screw and a gap. You can prep them if you need to. You can bend them, the monos I'm talking about, and you can get them exactly the way you want. If you have aesthetic problems in the front of the mouth, you can
Mhm.
keep your 2.5 wide implants towards the lingual and
Yes.
make everything look beautiful without having to do all the jump through the hoops that you'd have to do with the wider implants.
We really can't even say enough about the advantages and the benefits of the one piece implants. And so I'm sure our audience listening has really got that point home. But one of the things I want for my colleagues to express to this audience is how they've been able to change their practices. For instance, I know for you, you've gone to a 3-day work week. Tell me a little bit about the blueprint of that and tell me what you do when you're not working those other days.
This summer is a good example. Since June, we have been flying the airplane that the minis and one piece implants has bought.
I
And
forgot to tell the audience that you were a pilot as well. There you go.
in fact, I'm supposed to go out and teach some flying this afternoon. I found that if you're going to do anything in life, if you can teach it, you'll get better at it too.
Absolutely.
And so that works
Absolutely.
with dentistry and that works with implants. This summer, I've got 4 trips to Colorado, 2 to Delaware, where my daughter is, 2 to Buffalo, 1 to Canada, 1 to Washington, D.C. 90 hours of flying in 3 months is a lot.
Tell the audience how you manage this 3-day work week, 3 weeks per month.
When I was first in practice, I was working 5 or 6 days a week and taking 1 week vacation all year long. That whittled itself down to taking probably 3 or 4 weeks of vacation 15, 20 years ago.
Mhm.
But with the minis, now I'm making a lot more money and I can afford to take off more time. So I'm usually working Monday, Tuesday, Wednesday in the office and then hop in the airplane on Thursday and go somewhere. This is the only weekend I'm home this week. Next week is Texas on Thursday or Friday for my brother's 80th birthday. Next week after that, we're going somewhere. And then the next week after that, we're going back to the Dallas area to go to the International Congress of Oral Implantology.
Are you a member of the
I
ICOI?
am, and I'm working my way up, and I want to do the master and eventually the diplomat too.
That
So
is awesome. And that's one of the things about the ICOI is that they do have wide acceptance of the one piece implants. Unlike some of the other organizations where you can work your way up the credentialing ladder, the ICOI is very unique in that the body doesn't know if the implant is large or small. It's going to
nope.
integrate to it and it's going to function just the same. So a dental implant is a dental implant in that placing it and the body acclimating to it is pretty much the same. However, when you have a simpler, less invasive, less costly process, it really makes a lot of sense to at least consider doing that. So what would you tell doctors who are considering this one piece implant technology for stabilizing dentures or for single teeth with the monos? They're hearing about it for the very first time. And also they don't know anyone who is actually doing this procedure. What would you tell them? Would it be to just give it a try?
You need some training. This is kind of in general. Number
Mhm.
one, sit up straight. If
Yes.
you don't have neck and back problems as a dentist after the first few years, you're very lucky. Most
Yes.
of us do. Number two, I would make sure that you have a balance between work and play. In other words, look at your schedule. Play
Mhm.
with your kids when they're young. Take care of your kids when they're young. I had a wife that worked at the dental school 5 days a week from 8 in the morning till 5 at night. I was Mr. Mom. I dropped the kids off at school at 9 a.m. I picked them up at 3 in the afternoon. I got to be Mr. Mom and I enjoyed it very much. If you don't have an implant kit, get one. If you don't have a motor, get one. I
Yes.
highly recommend learning LPRF. Get one of the blood spinners and the supplies for doing that. Take a course on how to do Botox and why to do
Absolutely.
Botox.
The other thing that I wanted to ask, you have taken part in a lot of dental education and probably invested in different dental techniques in the office. Dollar for dollar, or if you want to say pound for pound, would you say that the investment that's required to start implementing the one piece dental implant protocol in your office is much less than other types of investments? But not only that, it doesn't take very long or very many cases to recoup those investments. What would you tell our audience about that?
You do one good case, you've redone your entire investment, and you don't have to worry about it.
And I tell people this all the time. I don't care how profitable a procedure is or how much it can improve my bottom line. If it was not a procedure that worked, or if I was doing a disservice to my patient, I wouldn't want to do it at all. The fact that it is very cost effective and offers a high degree of profitability, that's really just a bonus to the great procedure that it is. Would you agree?
I agree. Now, let me play devil's advocate here.
Mm-hmm.
I know that if I'm going to place 20 implants, I'm going to average one of them that doesn't stay in the mouth. Is that a failure? No, we don't use the F word in our office at
No,
all.
we don't.
We don't have any of those failures.
That's right.
But I do tell patients ahead of time, there's a chance this might not work. What are the things that affect that? If they're out of control diabetic, if they have hyperocclusion where they're beating their teeth to death, if
Yes.
they have really active infection, if they have very poor quality bone,
Mm-hmm.
all of those things will affect how well these procedures work. And
Absolutely.
I can honestly say that they work better than almost any other type of procedure, which I am amazed at because, like I said, I did over 1,000 conventional implants,
Mm-hmm.
and I'm sold on minis. Yeah, they
Yes.
will break once in a while if you have hyperocclusion, but I've had conventional implants break on me also in about the same ratio. I think the key on that is to identify the patients that have the huge masseters, that have that anagonial notch that is exaggerated, that
Yes.
have teeth that are all chipped and worn and flattened. You say to
Yes.
them, you have a hyperocclusion, you have a problem with destroying your own teeth, and we can do a couple of things to help with that, one of which is the Botox, which
Correct.
I like. But I also tell them there's other ways to get your teeth so that you're not going to be destroying them. Dr. Dawson, bless his soul, he used to tell us that there's generally two reasons why people destroy their own teeth. One is because they're not hitting correctly and you're trying to rub them out until they break. The other
Absolutely.
reason is because you hate your mother. Not really, but
Mm.
an example of that was I had a patient who was a nasty patient. You know how you look at your schedule and you see the guy's name and you say, I don't want to see him. The funny thing is that he was always bad attitude and nothing was right until he retired. Then he came in the next time after he had retired and he was a different person. He no longer ground his teeth. He no longer was nasty to the team, nasty to the doctor. He was a different person. His job was making him nasty.
Right.
So
That's
there's a
right.
lot
And
of
that's
different
and that's
reasons
something
why
we don't
people.
have control over, certainly. Well, Jim, I can't tell you how nice it is to always see you as I do at the meetings. And I am truly honored to have had you as a podcast guest. I'm sure that our listeners will glean something from your story that will help them make the decision in their journey. And your 3-day work week, we can't overlook that because that is about work-life balance and your play-life balance. So I think that those two things alone can help many dentists out there, including myself. So again, I
Thank
thank you
you.
so much for joining the podcast.
Thank you, Andrea. It was nice talking with you again.
You as well.